We're going to show a very common foot taping technique called a Lodi strap. A Lodi strap is a great diagnostic as well as treatment tool for patients who have midfoot pain and or soft tissue pain. Very commonly we'll see patients who have plantar fasciitis or heel pain. The Lodi strap generally is used for about a 3 to 5 day period of time prior to its removal. What I've done is put a spray on the foot, which is a skin adherent, and this allows the tape to adhere very well to the skin. Perspiration of the skin tends to cause the tape to get loose and will cause the tape not to function well on the foot. Our landmarks for the foot are the first metatarsal, as well as the fifth metatarsal head here. And what I generally will use, and I'll show an example of the tapes, I usually use an elastic material to go from the back of the, just behind the fifth metatarsal head, wrapped up into the mid-arch area. This elastic material tends to be a stretchy material which will decrease the chance of blistering, which can occasionally occur. There's no specific right way to Lodi strap. There are many different taping techniques, but the main goal is to help support the arch and decrease some of the mechanical loads. The next tape that I'll use is actually a tape from the fifth metatarsal under tension to the first metatarsal underneath the foot. The second 1-inch cloth tape is then overlapping the first tape and wraps around again to the mid-arch area. What we're trying to do is prevent or avoid wrinkles in the tape itself, which have a wrinkle will have a greater chance of developing a blister in the foot. And then we take the 2-inch tape, cloth tape, from the outside to the inside under tension. We duplicate that by overlapping approximately 50% up into the mid-arch. And then generally our last or third 2-inch tape is then applied from outside to inside under tension. And generally when we tape the foot is what we consider in a neutral position, where the second toe is lined up against the shin bone in what we consider a subtalar joint neutral position. The last tape actually tends to just help hold all of the tape ends in place, and is taken from the outside to the inside. Oftentimes, to help decrease perspiration or decrease moisture content of the tape, we'll also use paraffin or candle's wax to actually just decrease some of the tendency for the tape to roll. This is an example of a Lodi strap, very commonly used for arch and or heel pain, oftentimes used for pain in the midfoot region. And as I said, this can be left in place generally for 3 to 5 days. If you are taping your foot, it's not uncommon to develop blisters in this area of your arch. So certainly if there's any pain associated with the tape itself, certainly go ahead and remove the tape on your own. The last thing that we generally do with the tape technique is have the patient really extend their foot up, and we'll place 2-inch tape overlying the rest of the taping to then help hold the foot in a very stable position. This is generally done prior to the use of the paraffin. This completes the Lodi strap.